Really pleased to be presenting here in Manchester because SkinBioTherapeutics is a Manchester company. We're based in Manchester, and in fact our technology came out of the University of Manchester, so we're very much the local team here tonight. So SkinBioTherapeutics is about products for skin in health and in disease, and we have a particular technology that we're developing which is based on the microbiome. And if anybody's not sure what that is, fear not, because I'll tell you about that in a minute. But first of all, our disclaimer, which basically says don't believe anything I'm about to tell you. Really, you can believe some of it. Okay, so the company at a glance. We're in a new aspect of microbiome research, which is always a good place to be. We've got proof of principle for 3 potential applications. There are many more applications, but there are 3 that we're pursuing as a company. We have our own proprietary IP, 3 patent families, and all our data is supported by peer-reviewed, published papers. And that's important to me because I'm the academic that invented this technology, so having robust peer review is important to me, and as you'll see, it's been important to potential licensees that we've been talking to. Our board is very experienced. It's a healthy mix of science and guys that are very experienced in the business world, which is what we need for a company at our stage. Our business strategy is that we're scalable, it's very low cost, we operate virtually, we haven't invested in offices and that kind of thing. And our model is to out-license or partner very early in the process. And we've got value inflection points in the near, the medium and in the longer term, and by near I mean very near because we're currently in human studies. This is a snapshot of where we are. We listed on AIM last April, so we've been going about 18 months. We raised 4.5 million at a share price of 9p. Our current share price wobbles around 21p, so we've done quite well on AIM. Our market cap around 25 million, and we're in a healthy position in terms of our cash, because we've got plenty of cash in the bank that takes us beyond our first major milestones. Our year end is June, and that's our AIM ticker. This is just our major shareholders, who are Probiotics, who some of you may know, Seneca Partners, who cornerstoned our IPO, the University of Manchester are equity owners because that's where the technology derived from, and then myself and my academic colleague who were actually the inventors of the technology. So that's kind of what we look like as a company. Okay, so what's our technology about? So the human microbiome is just the name that's given. It's just a technical name for all the bacteria living in and on our bodies, and there are an awful lot of them. There are at least as many bacteria in and on us as there are human cells. So those are interesting philosophical discussions you can have about what it really is to be human, because we're at least 50% bacterial. Now the microbiome also has got about a million genes in it, whereas as humans we only have 23,000 genes. We're actually a bit puny compared to the bacteria that live in and on our bodies. So what that really means is all those genes in all those bacteria, they have a massive potential to change how our bodies function. And in fact they do. The bacteria in our gut, for example, help us digest our food and make some vitamins for us. So our bacteria really help us live healthy lives. Sometimes they're referred to as friends that we didn't know we had, because it's quite an emerging area of research, the microbiome. Now, the best understood aspect of all these bacteria living in and on us are the bacteria in our gut. And I'm guessing that most people here will have heard of probiotics. Yes, general nods. So probiotics have been a huge commercial success. And these are bacteria that come from our gut, and we know that they are effective in a number of conditions of the gut. So they generally work by stopping pathogenic bacteria that can cause disease from invading our gut and taking up residence there. They're very good at strengthening the gut barrier. Our gut not only has to be able to absorb the food that we eat, but it's also got to be a barrier against anything toxic or pathogenic that we may have inadvertently swallowed. So that your probiotics in your gut are very good at strengthening your gut as a barrier. And they're also really good at healing wounds in the gut. So a number of years ago, we were thinking about these benefits of probiotics, and we thought preventing pathogens, strengthening the barrier, healing wounds, all these effects would be great if they also worked on skin. So we thought, instead of eating probiotics, which is what most people do, could we actually develop them just to rub them in? Could we develop them as topical preparations, and would they have the same activities on skin? So that's what we did. And SkinBio is actually an early mover now in the topical use, but of lysates or extracts of probiotic bacteria. Now, why are we using extracts? Well, there are two reasons. One is safety. So even though probiotics are known to be very safe bacteria when you swallow them, we don't know necessarily if they're safe on skin if you put them on live, especially if you put them on wounded skin. So we thought that using an extract, so a preparation that contains no live bacteria, that would be very safe. So that was our first criterion. They had to work as a dead preparation. And the second reason we wanted to work with extracts was just formulation. So if we're making things for skin, we need creams, gels, lotions, etc. I don't know how you keep live bacteria alive in creams. So we decided if we could find strains of bacteria that would work as a dead extract, that would be great from a practical point of view for being able to formulate them, but also for safety, which of course is extremely important. So that idea formed the basis of what we call our SkinBioTherapeutics platform. So SkinBioTherapeutics is our trademark name for our technology, and this is basically an extract of a probiotic, but it contains no live bacteria. Oh, there we go. Okay, so what applications are we targeting? So we're targeting the cosmetics industry. The cosmetics industry, have I skipped a slide here? No, I haven't skipped a slide. Okay, the cosmetics industry, as you'll be aware, the ladies in the room, very, very big industry. There's a cream for everything, basically. And gentlemen's grooming is getting more and more important also. The eczema market. The eczema market is, there's a very, very big unmet need for novel therapies, better therapies for eczema. So there's a couple of things wrong with, well, there's lots of things wrong with eczematous skin, but two of the main ones are that it doesn't function well as a barrier, and it gets invaded a lot by a nasty pathogenic bacterium called Staphylococcus aureus. So if you've got a technology that can build a barrier and inhibit Staphylococcus aureus, you've probably got a very good indication there that your technology will be great for eczematous skin. And also infection. We all know if we visit anybody on hospital wards, there are those hand sanitizing pumps outside wards, etc., because we know that most infection is passed by skin contact. So if you've got something that can inhibit infectious agents, that's a really good technology for the infection area. So let's have a look where we've got to. So this is some science for you now. So this is looking at the barrier effect now of our SkinBioTherapeutics technology. And this data is pertinent to both our cosmetic application and our eczema application. So this is our model. This is real human skin. It's just sitting in a dish in the lab. And we basically get that from the offcuts of plastic surgery procedures. Yeah. So my lab have a wonderful time. Sometimes we get several feet of it coming in, depending on what operation's being done. And they spend many a happy lunch hour defatting it and preparing it for our experiments. But it's a great model because it is real human skin. Now, what we've done here, we've either just left it untreated or we've treated it with our SkinBioTherapeutics technology. And the green is an indication of a protein that's really important for the barrier property of skin. So obviously your skin is a barrier between all of you and everything out there. Skin is the mother of all barriers. And there are particular proteins in skin that help it to be a good barrier against the outside world. And this is one of them. And you'll note that the green staining is much brighter when we treat with the technology than when we don't treat with the technology. So this is an indication that we've boosted the levels of this really important barrier protein. And that's important for both our cosmetic application, because if we build a better barrier, the skin is more hydrated, it keeps more water, and it looks and feels better. And it's also important for our eczema application, because as I said, eczematous skin has a very weak barrier. And we can show that this effect is significant at doses well below what we're allowed to use from a safety perspective. Okay, so in order to take that into skin in actual humans as opposed to bits of humans sitting in a dish, this is what we've had to do. So we've had to manufacture and scale up making the technology. And we now have it successfully manufactured by an external partner, and the material that they're producing is consistent to what we've produced in the lab. We've had to get it into a cream, so we've had to formulate it. And we now have a cream formulation that shows effectiveness, so it does the same thing as just the technology on its own, and stability. We've had to satisfy some safety requirements, which are just it's known as cytotoxicity tests that we've had to pass. And these are the tests that we've had to pass to be allowed to test it on humans. So we've met that regulatory requirement. And actually this one slide's about the last 18 months of my life. And one slide doesn't really do it justice, because when we started, we had a tiny amount of a very boring colourless liquid in a test tube in my laboratory, and now we've got a cream and we can make our technology at scale. So we're really pleased with the progress that we've made over the last 18 months. So we're ready now to go into a human study, and in fact our human studies have started. So at the moment we're doing human safety studies, so we've shown safety that we have to do to be allowed to go into a human. Now we're doing safety studies in humans, and those studies are happening right now. And if the other side of Christmas, we're going to have a cosmetic study in humans to look at the efficacy now of our technology. And this is being run independently by Alba Sciences in Edinburgh, who are a specialist cosmetic testing house. We're putting 120 volunteers through our study. They're going to be treated with the cream for 4 weeks. And then we're going to take lots of measurements. And the measurements are all around, has the barrier function of the skin improved? So we're going to do a measurement. This stands for transepidermal water loss. So basically, if your barrier is working better, you lose less water through the skin. And consequently, corneometry, which is the fancy term for how hydrated is your skin, corneometry should be higher, so there'll be more water trapped in there. Erythema is just how red is the skin. So if it's better hydrated, it's probably going to be a bit less sensitive and a bit less red. Elasticity, so all that is, if I pinch my skin and let go, it should snap back into place very, very quickly. So if the elasticity is better, the skin is overall healthier. And we're also doing microbiome analysis just to check that our technology doesn't do anything detrimental to the microbiome. So everybody wants to see on packaging now for cosmetic products, safe for your microbiome. So that's why we're doing microbiome analysis as well. So we're very close to this study, and as I say, we're in humans now looking at safety. Okay, so what are we doing for our infection and eczema program? So again, this is skin. The blue staining is the cells of the skin, and this red is this nasty pathogen Staphylococcus aureus, which is very important in eczema. So when people's eczema flares, usually you can find an awful lot of Staphylococcus aureus in their skin, and it's been shown in studies that if you can inhibit Staphylococcus aureus, you can prevent eczema flares. So this is without the technology, and you'll see that there's red all the way through the skin, but on the right there, in the presence of the technology, no red staining. So this technology is stopping Staphylococcus aureus from invading the skin, which is great data. I really like that data. Now this graph, this is looking at how Staphylococcus aureus grows on those little skin models. So without the technology, the line goes up because it's growing quite happily on the skin. With the technology, this line is flat, so we've stopped it growing. So we've stopped it growing on the skin and we've stopped it invading. And we've done lots of science confirming the dosing and the frequency of application that we'd need. And as I said, this is applicable to our eczema and our infection programs. And because this is eventually going to be tested in a disease, the regulatory requirements before we can go into humans are a lot higher. So what we're doing at the minute is preparing our dossier that we need to take to the regulatory authorities to be allowed to go into a cohort of eczema sufferers. Okay, so the highlights since we IPO'd, remember this is only 18 months ago, so we've now got production of cosmetic grade SkinBioThics at scale by a third party. This is really important. We've worked out a method of freeze drying it. So it's actually the freeze-dried material that we want to commercialise, not the cream that we've made. The cream that we've made is just so that we can rub it in some volunteers to see how it works. But it's actually the freeze-dried material that we want to commercialise for other people to put into their creams and gels. And freeze-drying is really important because it provides shelf life for the technology and ease of transportation, the sorts of things that larger companies, that's very important to them. We've shown in vitro safety, and as I said, we're in human safety studies now. We've got a formulation and scientific progress, as well as the data that I've shown you. We've also had patents go to grant in 3 territories. We've also got a grant in conjunction with the University of Manchester to enable us to do some pipeline work and develop new technologies to come into the company. We also have a material transfer agreement with a global consumer goods company. So what that means is we have an agreement where we've given them some of our technology for them to test in some of their own in-house tests that they do. So this is what our pipeline looks like. The cosmetic study, as I said, we're into human studies now. And when we come out the other side of those human studies, that's when we'll aggressively try to commercialise our technology. And our infection and our eczema programmes come online a little bit later on because, as I said, we've got higher regulatory hurdles to get over before we can take those into human studies. So our business approach, obviously we're platform derived and we're developing our platform. We're continuing to build our portfolio of intellectual property and also supporting science because we know that that strong scientific base drives partner engagement. So when I sit in front of large multinationals and talk to them about our technology, they love the fact that this has come out of an academic environment and we've got published data on it. So the large globals really love that. They like that robust science. We've got licensing potential during technology development if we wanted to. And as I said, our initial market focus is on that cosmetic application because that's the first into human studies. So our outlook for the next few months is just the human study and the analysis of the data that comes out of that. We'll continue to, we'll ramp up our commercialisation discussions once we get that data coming through, and we're going to progress the regulatory pathway for the other 2 programmes. And obviously, because science is at the heart of SkinBioTherapeutics, we'll be continuing the scientific progress of the company. So just in summary, we've got a robust technology with which we can target large global markets. Our scientific team has got close ties to industry and we're supported by a very experienced board. We've got a scalable business model and of course we've got near-term value inflection point coming up very, very soon. And just to leave you with the thought that SkinBioTherapeutics is an early mover in applying probiotic extracts to skin. Thank you very much indeed.
Just a question on probiotics in cosmetics. Is there anyone who has a product that incorporates any probiotic technology at the moment, and what is it and how does it sell?
So there are cosmetic products out there with probiotic extracts in there. The very, very big difference between us and them is that they have very little, if any, underpinning science. So what we know, because we've done rigorous screening studies, is that not any old probiotic will do. You can take some probiotic extracts, they do nothing to skin, and you can take others, they're actually toxic to skin, or you can do it properly and isolate ones that have real efficacy on skin, and that's the approach that we've taken. And when we talk to potential licensees, the reason that the big guys haven't done anything with probiotics yet is because everything that's out there that they might want to acquire doesn't have the scientific rigour underpinning it. So the cosmetics world is changing and has changed a lot since 2010 when Boots were highlighted for their Protect and Perfect product. Yeah, some of the ladies are nodding here. The ladies know about Protect and Perfect. It was one of the top 10 phenomena of 2010. So what happened in 2010 was my colleague at the University of Manchester, who is she works on the biology of ageing. She went on a Horizon programme that was about the beauty industry and said, Boots Protect and Perfect actually does have some anti-aging effects, and it had been sold for a number of years, but after she said that, it flew off the shelves. It was on back order in every Boots outlet in the country for about 6 weeks. And that changed the face of the cosmetics industry because a scientist said, this works, and here is the data, and here is the published data to support that. And that's changed things. So the big guys, the serious players now, understand very much the value of doing very robust scientific studies and publishing them. So we're not so worried about the other people using probiotics in skincare.
Okay. Any other questions for Kath, please? I've got a couple more. Gentleman with the white shirt, please.
Yeah, just, there's no numbers. I should have looked at the numbers before I came here, so sorry, Kath. But, and often, boffins don't make the greatest business people.
Yep.
So I
Are
just...
you suggesting I'm a boffin?
That was your words.
Fine.
So just, I think the eczema one, you said 21, 22. Are you going to get that far without having to raise more funds?
No.
And also, what's the commerciality? What's the commercial program for licensing? Okay.
So we've always been very open about the fact that we will have to raise more funds. And that was in our admission document, but hopefully, we're already at a much higher valuation than we were when we first went to IPO. So that's always been our plan, that we would have to raise more funds to do those studies. And I'm sorry, what was the other part of your question?
I wasn't too sure what the commercialisation...
Oh, okay. Sure. So our model for all our applications is to partner with a larger commercial entity that can do the true commercialisation. So we're not intending as a company to take anything to market ourselves. Our plan is to license or co-develop or whatever with a partner that can drive it through to true commercialisation.
And do you have a question here? Do you have a question?
Yeah. When you say you're going to partner, are you going to go into exclusivity agreements, or are you going to keep your options open?
I think that very much depends on what's on offer and who it's on offer from. To be honest, I think we'd look at things case by case.
Any other questions, please? Oh, hello, Kate.
Regarding the eczema product, which seems to have significant opportunity, is there any possibility that you're going to end up developing anecdotal information from people using the cosmetic products off-label?
You've spotted our strategy. Yeah. So the real value in SkinBioTherapeutics is the eczema program. So one of the reasons for doing a cosmetic, of course, we expect it will be a great cosmetic anyway, but the added value of doing a cosmetic study is extra safety data, and also it is entirely possible that people with eczema may be using it, and yes, you can start to collect that kind of data and get that kind of feedback, yes. So lots of reasons for doing a cosmetic.
Just one from me, if I may. You mentioned in the human study there are 5 measurements, including things like elasticity and, I forget the name, redness in the skin. Yeah. How do you measure? How do you objectively say this is redder or less red or more elastic, less elastic?
Sure. So these are... there are machines that do this. So these are true objective measures. It's not just somebody going, yeah, your skin looks a bit less red. There are instruments that do this in an objective manner. These are very well validated, industry-used objective measures that are routine, actually, in this field. Yeah.
I think you see in the videos, it's the kind of the Rise Smileys in the cosmetics ads for the shampoo. 10 people said they thought their hair was shinier, and you think there's no robustness to that, is there?
Well, I can't comment on what other people do, but you'll note we're doing 120 people.
and what if, and there's been a couple of recent, not necessarily in your space, but companies who've been at quite advanced human trials, and they found the technology, for whatever reason, hasn't worked.
Just doesn't work, yeah.
What did the company do then?
Yeah, okay. So, it's unlikely that it would be that binary. So this is a cosmetic, so it's not like pharma where it either works or it doesn't, and if it doesn't, it's a big disaster. It's not that binary. It'll be degrees of working. And the other thing is, talking to industry leaders in this field, what they tell us loud and clear is that they recognise that when you take something out of a research laboratory, or any laboratory for that matter, and it goes into a human study for the first time, it's a bit like doing that. So you model as best you can what concentration of the technology to put in your cream, and you model as best you can what kind of formulation will deliver it, but it's still quite a big leap. So they recognise that. And so the feedback we've had from industry is that so long as there are no major negatives from this study, actually they would view that in a positive way. So the message we're getting is it doesn't matter so much if it doesn't work the first time, provided it doesn't make anything worse. So I sleep much better at night now.
Any other questions, please?
This question comes from pure ignorance. Okay. Can you just elaborate on the fact, will your products hold any exclusive patent value or notional value? Because, I mean, the cosmetic industry is notorious for bringing in products with formulas written in their adverts which don't have any scientific validity.
So we have patents. We have patents to grant already in 3 territories, and we've got another 15 applications out there in various territories at various stages of completeness. So yes, we've got IP protection, and as I said, some of our patents are to grant in some territories. Yeah.
Gentleman here, please. Thank you.
Hi. I see that it's working nicely on the skin. But what happens on wounds? So if you get a hole in the skin, can you put it on and make an effective barrier to prevent infections?
Well, interestingly, we can in the lab. Yes, we can. As a company, it's not an application area that we're pursuing. Wound healing is the graveyard of promising technologies that didn't quite make it for whatever reasons. It's a difficult area. So it's not something that we're pursuing ourselves, but you know, if somebody wanted to come and license the technology from us and develop it for that, we'd be open to that, yeah.
Any other questions, please? A lady at the back, please. Chris, are you there?
Hi there.
Hi.
With the cream, so this is talking about the infection side of things. Would you use the cream as a topical application for, you know, quite a long time so that it's working all the time? So, for example, if you've got eczema and you actually get a really, vicious case of Staphylococcus aureus, you would need, surely, would your cream work to combat the infection, or would you need something stronger, like, for example, Bactroban, you know, that's going to combat the infection, because it's a really ferocious infection, isn't it?
Yep.
So
the honest answer to that at the moment is we don't know. Yeah. We think that the most likely thing is that this will be extremely good at prevention of flares, which is really what you want to achieve.
Yeah, so it's a topical application you would put on
a topical application,
on a regular basis, not to combat a very vicious infection.
So the idea is that you'd use it routinely.
Yeah, all the time.
Yes, as part of your skincare program.
Okay.
Yeah.
Right. Cool.
Any other questions, please? We've got time for one more if there are any. Gentlemen here, please, Chris. Thank you.
Having patents is one thing. Trying to defend it is quite another.
Yeah.
I've been involved with 4 spin-off companies from universities, and all of them have had problems with defending their patents. How do you manage to do that?
Well, I mean, defending patents is always a problem, isn't it? Because your ability to defend your patent is directly linked to how much money you've got. But for a company that is predominantly IP-based, it would be foolish not to have some patent applications out there. I think what we have in addition is a vast amount of know-how. So we've been working in this area for the best part of 10 years. So we have an awful lot of know-how, which is possibly, you could argue, more valuable than some of the patents. It's not easy to come in and replicate what we've been doing, because it's actually quite a specialised area. So there are people that work on skin, there are people that work on microbiology, and sometimes, you know, the twain doesn't quite meet. So I think our know-how is what really protects us.
Okay, lovely. Thank you very much indeed. Thank you, Kath. Thank you for your question.